stiffness and permanent damage. It can, in the spine, it can lead to paralysis of the spine and then affect walking and movement.
Yeah, those are dire consequences.
Yes.
Thank you for educating us on all that. So we'll talk about another vaccine preventable disease, which is polio. Most people have heard of polio infection. What is polio?
Polio is an infection caused by the polio virus.
Yes.
It's an infection that was very common, especially in the warmer regions of the world. So we had it lots in Africa. Yes, sub-Saharan Africa is one of the key places that experiences polio.
Yeah.
And polio is particularly important because it is transmitted through just normal interaction. Cough can spread the viral droplets. And so when someone has polio, some people develop a mild disease, yes. But for some people, they can develop very severe disease. There's no one that hasn't either heard or seen someone with the polio paralysis of the leg, of the arm, and it can really affect because it causes something unique called flaccid paralysis, in which the muscles will be so weak that they won't function properly. So, for instance, polio was very, very common in children. So you would find children developing polio, and afterwards they would have paralysis of some of the muscles of their leg, which would prevent that leg from growing well. So a lot of them would have one leg shorter than the other due to
the
polio.
infection,
They would also have what is known as club foot. And some of them can have bow leg from it. And it affects their life forever because there's very little treatment that can be done, especially when it has progressed and has been there for a long time.
Wow, those are dire consequences. You talked about how it's already presents. Is there any treatment for polio?
There is no treatment for polio. The only treatment they can do during the illness is to give you supportive care. There is no actual drug that you can say, take this and polio will be cured. There is not. They can only give you supportive care while the infection is going on, and then afterwards manage if there's any complications. But the major way of preventing polio is through the polio vaccine. And this polio vaccine has been very successful where it is being used in preventing polio all over the world, reducing the polio burden up to 99.9%.
Wow,
all over the world.
That's good.
Yes.
So currently, what will we say the prevalence of polio is like?
It's very, very few cases are noted all over the world, with the only two countries now having polio cases in the world being Afghanistan and Pakistan. In Nigeria, we've not had any polio case due to the strength of the vaccine coverage in Nigeria. Especially because polio is unique in that the vaccine is oral. So there is no injection involved, just 2 droplets taken 3 times in a child's life can prevent them from ever having this dreadful disease.
That's very good. Thank you so much for that, explanation. I see that we are doing well when it comes to polio vaccine.
We are. Yes, we are.
Okay, so let's talk about another disease which is preventable by vaccine, hepatitis B.
Yes.
Yeah, in recent times there's been a lot of publicity given to the hepatitis virus. We have other serotypes, but hepatitis B has been concentrated on. What is hepatitis B?
The hepatitis virus is a group of viruses that mainly targets the liver. And hepatitis B is one of the 5 variants. We have hepatitis A up to E, but hepatitis B is unique because of the widespread nature of it. Hepatitis B is usually spread through exchange of body fluids, for instance, blood or through sexual intercourse. It can also be shared through blood transfusion and then improper handling of equipment or sharps. So for those people that do a lot of traditional scarification or facial marks, they can also have hepatitis through that, or a lot of circumcision, if not done properly, can also give hepatitis.
Okay, those are that's when you say body fluids, makes it look like it is easily transmittable, because we all have body fluids, and then these methods you mentioned about transmissions are very approachable methods. You get. Okay, so what are some of the symptoms a patient will present with when they have hepatitis
The
B?
unique thing that makes hepatitis B so scary is that when it presents, it can present as a very mild disease. It can present with just fever, yellowness of the eyes, just some malaise. You just feel ill, and then it can be briefly over.
Okay.
The main danger about hepatitis comes in 2 stages. In the initial infection, a very rare percentage can have what we call fulminant hepatitis, which can lead to death.
Okay.
Yes, and there's very little treatment available because it progresses very fast.
Okay.
But the major damage with hepatitis is in the long term. Though not everybody that has the hepatitis virus will eventually become chronic, which is the long-term version, but up to 10% of the people that have hepatitis will have the chronic version. And this chronic version will lead to something called liver cirrhosis, which is damage to the liver and gradual affectation of the normal function. So the liver will begin to shrink and begin to have other tissue that is not meant to have, and the function will stop.
Wow.
A lot of them can also have hepatocellular carcinoma, which is a primary cancer that is in the liver. And the danger about the liver is that it's such an important organ in our body with no other method of replacement. So when the hepatocellular carcinoma has come, by the time they usually have symptoms, it's usually too late for anything other than a liver transplant.
Wow.
Yes, and in children, because it's children we are dealing with today, in children it's important to know that in hepatitis, in an adult, if an adult encounters hepatitis B virus, maybe only 10% of adults will have that chronic version. But for the children, 90% of the children that have hepatitis before the age of 3 years develop chronic hepatitis.
Wow.
So almost all of them that have this hepatitis end up having this liver, cirrhosis of the liver and the liver cancer.
Straight up, wow. Okay.
So, and the cirrhosis, depending on the individual, can take 10 to 25 years before the symptoms even develop. But there's gradual destruction of the liver tissue, and then by the time even symptoms develop, there is usually no treatment available.
Wow.
For the treatment of hepatitis, as I said, the main treatment is to remove the liver and replace it with another liver, but some antiviral agents have been found to have some good effect in stopping the spread of the virus, but they do not cure the hepatitis. They won't remove it completely. They will only stop it from progressing further.
Wow, that's. Thank you so much for educating us. I like the way you talked about it in children, because people need to understand the importance of taking these vaccines and not just know that it's not just, well, we're not trying to just sell a cheap talk to you. They are really important, because the way the adult system would deal with an infection is way different from how a child's system would deal with that infection.
And also the method of transmission of hepatitis, one of the major methods of transmission of hepatitis, the way children get it is from mother to child.
Wow, so we're talking about breastfeeding?
No, during the process of birth, there's exchange of body fluids, and if the mother is not on maybe treatment for hepatitis and the child does not receive the vaccine, and there's also an immunoglobulin that is given to the child at birth, if they don't receive those things, they can go on to have that hepatitis.
So that means, from what we are seeing now, it is very important that the mother even knows her status.
Yes.
Because if we're saying we're trying to prevent the spread during birth delivery, then it's very important that the mother knows her status so that she can prevent the spread to her child.
Yes.
Thank you so much for educating us this way. So viewers, we'll be going on a break shortly, and when we come back, we'll keep talking about vaccine preventable diseases. Thank you so much.
Welcome to Clear on Health.
TSTV, connecting your world.
Welcome back, viewers, to our program Clear on Health on African Health Television on TSTV. My name is Dr. Fumilayo Elusojiri. Me in the studio is Dr. Ashioreka. We've been talking about vaccine preventable diseases, and we've tried to focus it on children. So far, we've talked about why it's so important. We've talked about tuberculosis. We've talked about polio. We've also talked about hepatitis B. So before we went on the break, we talked about, you know, the method of transmission of hepatitis B in children, and we saw that even children that developed hepatitis B before the age of 3 years old can easily progress to the chronic version. So I just wanted to ask a question before we move to the next, you know, vaccine preventable disease. Does breast milk transmit hepatitis B?
No, breast milk does not transmit hepatitis B. Once the baby has received the vaccination of the hepatitis B vaccine at birth and the hepatitis B immunoglobulin, it is safe to breastfeed.
Okay.
But it would be preferable if the mother does not engage in mixed feeding. That is, mixing the breast milk with the formula feed. It would be best if a mother can stick to one of those methods.
Yeah.
That will increase, or that will greatly reduce the child's probability of possibly contacting the virus.
Right. So it's so important that the mother is aware. You know, we talked about that before, aware of, you know, and I think viral load comes to play also in this
That's
case.
why the antenatal care of a mother is very important. During antenatal care, the hepatitis B virus is one of the things tested for at the antenatal visit. So that's why it's important for women to participate in antenatal care. Even if they've had children before, it's always good to go again and make sure you get the fresh testing. So if there's any need, all possible care will be given to your child.
Okay. Thank you so much for that explanation. So we're going to be talking about another disease that is preventable by vaccine, tetanus.
Yes.
What is tetanus?
Well, tetanus is an infection. It's a rather common infection that is caused by a bacteria called Clostridium tetani. And this bacteria is unique in that it usually likes places with very little, it doesn't need air to develop. It's an anaerobic bacteria, so it resides in all of things such as maybe nails, rusty nails, soil, things that are usually very dirty and people are not aware of it. So tetanus is so important in that when the person gets the contact with it, usually through a means of cuts or a puncture or something, when they get the infection of the bacteria literally travels through the body to the brain. And depending on the location or the immune status of the individual, they might not notice it until days after the injury. So sometimes they don't even connect it to that injury that they had. Especially for children, they are playing around, maybe they get stabbed by a nail, they don't even notice that they've experienced or anything. So until they start having symptoms, and the symptoms for tetanus can be severe, from mild to severe. They can have muscle spasms, they can have seizure, and they can have the characteristic thing you hear about tetanus, lockjaw, where they can't open their mouth, they can't speak or anything because the muscles are literally motionless, they can't move.
Okay.
So tetanus is also very important in neonates because you know children, when they are born, their immune system is not very well developed. So when they develop tetanus, maybe due to poor hygiene or anything, can lead to a very severe infection in them.
Wow.
Yes.
Wow. But what's the treatment like?
Well, the treatment for tetanus is quite difficult, and it depends on at what stage the tetanus comes. For instance, if they present early, you give antibiotics, you give things to relax the body, and then there are other drugs that are used, but mainly the antibiotics and the care and the tetanus immunoglobulin, which is a form of the tetanus that is, it's a substance that it contains the active form of the body fighting against tetanus. So it's an injection of something to help the body fight the tetanus. Yes,
Wow.
so that's usually given for cases of tetanus that are a bit sure. But a lot of people don't present early, and so they come in at a late stage when the lockjaw has already started. So in that case, death is possible. Yes, if the treatment is not started early.
Okay.
And then, but you need a lot of, you might need anticonvulsants, you might need things just help the body relax, and you might need some other drugs, and the treatment is quite difficult and takes some time. Even in children, neonatal tetanus, the treatment is actually taken for 21 full days
Wow. Okay.
at the least. So it's quite a severe infection that needs to be taken quite
very
seriously.
Very seriously.
Yes.
Thank you for that. But do we have deformities or disabilities that arise as a result of tetanus in childhood?
Yes, there can be, but mostly the damage is due to if not treated, it can lead to death.
Okay.
So usually with treatment, if it's caught early, a lot of the disabilities don't really happen, but it's something that in neonates,
Yes.
it's very dangerous because it can lead to the brain being permanently damaged, in which case the children don't grow up well.
Okay.
It can lead to seizures to them, and the seizures might not just last during the illness, but permanently in life. They might have a seizure disorder for the rest of their life because of it.
Wow.
It might also lead to blindness and deafness because it affects the brain and the coverings of the brain.
Those are dire consequences.
Yes.
And all we are trying to say now is that you can just prevent this
Yes.
problem by just taking a vaccine.
Yes.
That's
and,
what we're trying to publicize.
and the vaccine for tetanus is not difficult. It just takes at least 3 doses of the vaccine for children. For adults, it's 5 doses. But when you receive that vaccine as a mother, if you receive it during your pregnancy, it protects your child against that tetanus. So
Bringing the importance of antenatal care back to the table.
very important.
Very important,
Very,
yes.
very important.
Yes, thank you so much for that explanation. We've already talked about the treatment, right, of what we can do for tetanus. So let's talk about Haemophilus influenza B virus. I didn't want to call it pneumonia because I feel pneumonia can be caused by a lot of things.
Yes.
But let's just talk about Haemophilus influenza B infection. Sorry, not virus. Infection. So how does it present?
Haemophilus influenza B, it's a bacteria that it can cause mild to severe illness, especially in children.
Okay.
And then the extent of the infection, depending on where it is,
Yeah.
it can just cause, let's say, a sore throat if it gets there. But the more dangerous presentations are in the lungs, it can cause pneumonia, and in the brain, it can cause meningitis. And the reason this bacteria is so important that it
Yes.
deserves its own vaccine is that it causes quite a number of infections frequently. It's one of those infections that are spread by coughing and then exposure to the droplets when you meet someone that is infected. And in a child or in a person that has low immunity, this infection can go on to lead to very severe disease that can lead to pneumonia, can lead to permanent lung scarring and even death. And in meningitis, it can lead to various complications. It can lead to seizure disorder later in life. It can lead to affectation of the sight and even the hearing of the child.
Wow.
So it's important, and it seems like this particular vaccine and generally a lot of the vaccines, what they do is when this infection comes, because sometimes you can still have the infection, what it causes is that the body has already been primed to know that particular bacteria, and so the individual has a milder form of the disease with less complications.
Wow. Okay. That's really good. I see that we've talked about the symptoms, and symptoms are not anything that anybody wants to joke with, not at all. What's the treatment like?
Well, it's a bacteria, so it can be treated with antibiotics.
Okay.
But the important thing to note about it is if we can prevent it and prevent our children from having any severe illness due to it,
Yeah.
why not
Just
go for
that
that
route.
option instead of trying to manage a severe disease caused by a bacteria that
Yes.
it is easily preventable.
Oh, okay. Thank you so much for that explanation. I think the next vaccine preventable disease we'll be talking about is measles. What is measles?
Measles is a disease caused by the measles virus.
Okay.
And the interesting thing to note about measles is that when everybody thinks of measles, think of the rash. But usually those are not the first symptoms to start for measles. Measles actually presents with cough, catarrh, and fever. And then after a few days, when the measles is not well treated, or when the measles develops, you can develop that rash characteristically over the body.
Wow. One of the things I got from what you were saying was that you mentioned fever, because it's worthy to note that fever is not just caused by malaria
No, it's
and
not.
typhoid.
No,
A lot
it's
of
not.
things, especially in children, can cause fever. So every time a child has fever is a red flag as opposed to an adult.
Yes, we shouldn't always make that assumption in children that
Yes.
malaria is the cause. It's one of the possible causes for fever, especially in children.
Yes.
But it's not the only cause. And it might not, depending on where your malaria preventive capabilities as a parent, or it might not even be the most common cause.
Yeah, in
Children go out, they interact with other children. For instance, diseases like measles are passed from child to child. And maybe a child is coughing in class, the early stage of the measles, they cough, the other child gets it, and then they come back and develop their own cough with the catarrh and then the fever. And later, a few days later, they develop that rash.
Wow. Is there like a treatment for measles?
Like a lot of viruses, the main treatment for measles is mostly supportive, which means depending on the symptom the child has, they treat. So, okay, if it's the skin, we give all necessary care for the skin. If there might be any additional bacterial infection, we can give antibiotics, we give fluids, and depending on the presentation. But the thing about measles is that measles in a lot of children goes by itself. It's what we call a self-limiting disease, in which case the disease progresses for a while and it just stops by itself. But some people, some children, 10 to 15% can develop various complications as a result of the
Infection.
Yes, they can develop blindness as a result of the measles infection. They can develop what is called measles immunosuppression, in which case the measles is not what causes that major disease, but the measles reduces the immunity of the child so low that they can easily develop any other conditions that in which case they would normally not have, but it can develop severe disease. So they can end up having severe disease as a result of the measles infection.
Wow, that's terrible.
Yes.
Okay, thank you so much for that. Now, closely related to measles is chickenpox.
Yes.
Because it's also a skin stuff
Yes.
that happens in children and even adults. What is chickenpox?
Chickenpox is it's a infection by the varicella virus.
Yeah.
Yes. It presents with the rash that we know. Yes, and usually the notable thing about chickenpox, and it's very notable, that once you've had it, you don't have it again. So that's why the vaccination of chickenpox is so important, because once you are vaccinated from chickenpox, the likelihood of you having chickenpox ever in your life is less than 0.001%. Almost nobody that has had the chickenpox vaccine or has had chickenpox ever develops the disease again. So it's important that we vaccinate our children to make sure that they don't even if there is an outbreak going around, because it happens, an outbreak, because it's easily transmittable from child to child. When they scratch, they carry the virus into, and it can easily spread to the next child. It's important to prevent it, so it's important to take the vaccine so the child never gets it. So even if an outbreak, you are safe about the condition of your child.
That's good. Thank you so much for that. Now, apart from the rash that comes with chickenpox, are there other symptoms that?
Yes, they can have symptoms of illness. They can have fever. They can also have some other flu-like symptoms like the cough and catarrh. But the main problem with chickenpox is the rash.
Yeah.
Yes.
We can see another cause of fever going on here. I want people to be more aware of the fact that the cause of fever in your child can be a lot of things other than the usual things that you think they are. So we'll talk about another vaccine preventable disease called yellow fever. I don't think people remember yellow fever as well as it used to be.
No.
But what is yellow fever?
Yellow fever is a disease caused by the yellow fever virus, and it presents in a rather similar way to the hepatitis virus we earlier described, with sore throat, with fever, yellowness of the eyes, and it can affect the liver and cause permanent liver damage if due to like low immunity of the person. Yes, and it's one of those fevers that is spread by insect bites.
Wow.
Yes.
Okay.
So it's actually spread by an insect vector. So, and here in Nigeria, a lot of insects are flying around, and sometimes you're not aware of which insect bites you. A lot of times people assume it's a mosquito, but there are other insects. In fact, the insect for the yellow fever virus actually belongs to the same family as the mosquito. Yeah. So they can be rather similar, and then unfortunately some people develop that severe illness which can lead to death if not treated properly, and lead to permanent liver damage if not treated properly.
Okay. Now, the permanent liver damage about this is really scary too.
Yes.
But the treatment, what's the treatment for yellow fever going to be like?
Yes, you can use various antiviral agents, but like a lot of viral diseases, the treatment is mostly supportive.
Okay.
Mostly supportive. So whatever care the person needs, if the person needs fluids, the person gets fluids. If they need any other treatment, depending on the symptomatology or the symptoms the person has, that's what they receive. Yes.
Thank you so much for your explanation. So viewers, we'll be going on a break shortly, and when we come back, we'll keep talking about vaccine preventable diseases. Thank you.
And welcome to Clear on Health.
TSTV, connecting your.
Welcome back to our program Clear on Health on African Health Television on TSTV. My name is Dr. Fumilayo Nisoji. With me in the studio is Dr. Oreka Ashe, and we've been talking a lot about vaccine preventable diseases. So far, we've talked about tetanus, we've talked about tuberculosis, we've talked about yellow fever, chickenpox, measles. Right now, we want to talk about rotavirus. Rotavirus is one of the vaccine preventable diseases. What is rotavirus?
Rotavirus is the virus that causes the disease, and the disease that rotavirus is causes is diarrheal disease in children.
Okay.
So rotavirus is unique in that it's a group of viruses that cause diarrheal disease, usually severe diarrheal disease in children.
Okay.
And it's estimated that over 500,000 children a year die from rotavirus disease. And it's actually a recent addition to the immunization schedule in Nigeria because of the importance of it.
Okay.
Everybody knows that diarrheal diseases are dangerous in children because children easily develop dehydration, which can lead to electrolyte imbalance, which can lead to death in them. So that's the importance of taking care of these diarrheal diseases. And rotavirus is unique in that one of the major culprits for these diarrheal diseases in children. So what this vaccine does is that it helps to immunize the children against the rotavirus and prevent them from having the disease and make them have less severe disease. So it's estimated that by the time rotavirus is fully incorporated into the schedule, over 160,000 children will be saved from death in Nigeria, just from incorporating that vaccine. That should show us how important the diarrheal disease is in children, because a lot of the diarrheal disease in children, that means when they have diarrhea, they are vomiting. I mean, a lot of it can be caused by some bacteria, but most times it's caused by viruses. And rotavirus is one of the major factors that causes it.
Okay, so that means for the people that will be treating with an antibiotic like Flagyl, treating their children with Flagyl, because they have passage, I think we should even explain what diarrhea means. Passage of watery stool. Yes. Sometimes that may just not even help at all because it may be caused by
a virus. And rotavirus is one of the viruses that causes it.
Okay, and I think we should be happy that currently Nigeria has seen the need to put this in their schedule.
Yes, it's rather important because it will save quite a number of children from having this particular virus.
Okay, thank you so much for that explanation. Now, so far, all the diseases we talked about have their vaccines.
Yes, they
now,
do.
Does vaccination always prevent the disease?
Okay. Vaccination does not always prevent the disease.
Okay.
But it's important to note that in most of these diseases, when the vaccination occurs, it's important to understand a little bit about the process of vaccination. Okay. When you vaccinate a child or even an adult with a disease, a disease, what you're doing is you're introducing the child or the adult to a component of the organism. So sometimes it can be the dead organism, sometimes it can just be one of the proteins coating the organism, but you're introducing the person to something about the disease, so their body can get familiar with it. Okay. An analogy would be if you're suspecting some armed robbers coming within an area and you happen to have their pictures and you take the pictures and you show it to the security around the area, the time they see the armed robbers, they have a quick response because they have already identified and recognized that armed robber, so they can prevent the armed robber from stealing. And even if the armed robber has already started stealing, they can reduce the number of things or people affected by that stealing. And that's exactly how vaccine works. They help to prevent the disease from ever happening at all, or to reduce the severity, because the body is now primed to respond to that illness.
Wow, thank you so much for that explanation. Are there other ways that, other factors that can increase the child's resistance to diseases apart from vaccines?
Yes, there are. Okay. As parents, there are quite a number of roles that are needed to play to prevent some of these diseases in children. For instance, tuberculosis, one of the major preventive factors for tuberculosis besides the vaccination is just preventing from overcrowding, which means you live in an area, you don't put 8 people in one single room with very poor ventilation, And that can go for a lot of these diseases that are spread by cough droplets, of which we have mentioned quite a few, from measles to
chicken pox.
Yes, can be prevented by close contact, pneumonia. I mean, all those things just by having an awareness of prevention of overcrowding. Even good hygiene can help.
Wow.
How good hygiene helps is that it helps to reduce the stress on the child's immune system from encountering so many diseases. It can really help to improve it. Third, another thing that can really help is very good nutrition.
Okay.
When you give your child good nutrition that is balanced, has all the necessary food groups, including fruits and vegetables, good amount of protein, good amount of carbohydrates, good amount of fruits and vegetables, which contain all the macro and the micronutrients, you help to give the child the building blocks to build their own immunity up.
Okay.
So the food we take is what our body uses to create the different methods of immunity. So when we supply these foods to the child, we give the child what they need to build their own immunity.
Wow, that's good. So these are just like basic things.
Yes. Another method that a lot of people are not very aware of is actually breastfeeding. Breastfeeding is one of the major ways that a newborn baby receives immunity. In the breast milk, the mother's immunity gets passed to the child. It's what we call passive immunity. So, and this immunity lasts for up to 6 months. So in the first 6 months, if you breastfeed your child well, you can actually pass on a significant amount of immunity from yourself to the child.
Yes.
But that also implies that you have a good form of immunity, which means that you also have to make sure you take care of yourself as a mother to be able to breastfeed. You also make sure you eat well, rest well, just take care of yourself so you're able to pass on that necessary immunity to your child.
Wow, thank you so much for that explanation. I think so far we've been talking about vaccines, diseases and all that. I think now we should talk about the current immunization schedule in Nigeria. So what is it like?
Okay. The way the vaccine schedule has been designed in a way to minimize the number of contacts a child needs.
Okay.
So it has been spread over quite a few contacts. The first one happens at birth, which is why it's always good to give birth to your child in a health facility, so the child can get those necessary vaccines even before 24 hours of life has passed.
Yeah.
And those 3 of the major vaccines that we've talked about, 3 of the major illnesses that we've talked about are actually giving vaccinations at birth.
Okay.
Yes.
Which is the
we have the BCG for the tuberculosis. And it should be noted that the BCG is the only vaccine that is available for tuberculosis. And that's what's given at birth. So it's not an encounter that a child should miss. Yes, and then we have the hepatitis B vaccine, which is especially important in those mothers that have hepatitis B, because that's one of the major ways of preventing your child from actually having it. And then we have the polio vaccine.
Okay, okay. Are there vaccines that are not on the EPI schedule that are important for children?
Yes.
Okay.
Yes. There are quite a number of vaccines that are available, but likely due to logistics and cost of making those vaccines available, because currently all the vaccines that we'll talk about in the EPI, the schedule for vaccination in Nigeria, are free. Okay. Which means you go to your nearest public health center, you can get those vaccines free. Okay. So we mentioned the first one at birth, and then we later have at 6 weeks of life, at 10 weeks of life, and at 14 weeks of life. Okay. And the vaccines collected then is a particular vaccine. You might have heard of it. They call it Penta. It's called the pentavalent vaccine, and it actually contains 5 vaccines in one shot. And it contains the diphtheria vaccine, the tetanus vaccine, the pertussis vaccine, the hepatitis B vaccine, and the Haemophilus influenza B vaccine. And from what we've discussed the importance of those vaccinations. Yes. And that pentavalent is repeated 3 times. That's at 6 weeks, 10 weeks, and 14 weeks. Also given at 10 weeks and 14 weeks is the rotavirus vaccine that we mentioned. So it gives a child the opportunity to get that rotavirus vaccine. Also given is the polio vaccine. at 6 weeks, 10 weeks, and 14 weeks.
Okay.
Then the next other vaccination encounter that the children have is at 9 months for the measles and yellow fever vaccine. And after that, that concludes the vaccination schedule for the national program.
Okay.
But there are other vaccines that are available at different times in the calendar schedule. You can have vaccines from the cholera vaccine to the typhoid vaccine to the meningitis vaccine, which is usually given free, but it usually depends on if there's an encounter with outbreaks, and it's usually situational. And then you can have the flu vaccine also given. And there are also boosters available for other vaccines. Then the vaccine for hepatitis A and hepatitis C is also available, but usually you will have to pay for those vaccines.
Okay, okay. So I think we should reiterate, how has immunization reduced the disease burden in Nigeria?
Wow. One of the major ways, there are quite a number of diseases that are very exemplary of how the vaccine schedule has improved.
Yes.
Polio, for instance. The polio burden in Nigeria has reduced by 99.9%.
That's big.
In fact, in the last few years in Nigeria, there hasn't been any polio case. That's due to the immunization.
Yes.
Also important is the diphtheria disease and the pertussis disease, of which many people might not have even heard of it because of how rare those diseases are. This is the work of the steady vaccination program. I mean, out of the world burden of diphtheria, Nigeria accounts for maybe 0.1%, with just a few cases, not even up to 100 cases a year in Nigeria. Similarly, for pertussis, the cases might be there, but sometimes they are not even noticed. They are just passed on as a normal upper respiratory tract infection, or one of these, the child coughs a bit, because the vaccine has severely reduced the severity of the disease. So even if the child encounters the bacteria, it's not even noted enough to present the classic symptoms of that particular disease.
That's great, and I think in that aspect we've done well.
Quite well.
I feel we can do better.
Yes.
You know, recognizing the infections that are trying to be prevalent and then doing something about it. Thank you so much for that explanation. Now, during antenatal care, it is reiterated that mothers do certain things. You know, I'm sure they talk to them about, you know, vaccinating your children on time and all that, especially when in the postnatal period. Those things are reiterated. Now, what are some of the reasons why vaccination is not adhered to as it should?
Okay. It is said that only about 70% of Nigerian children get vaccinated at all. And of those, only 35% get the full range of vaccination. That's from start to the end of 9 months. And this is usually due to a number of things, most factors of which are social.
Yeah.
For instance, a common cause of the vaccination is some parents don't believe in vaccination. They don't believe it has any benefit for their child. And that's partially why we are talking about this, to let parents know how important this vaccination is and how it can prevent illness in your child and even reduce the burden of illness on the family.
Wow, wow, that's good.
Another reason they don't take it is some people are busy. Some of the reasons they found is that some people are busy. The caretaker, the primary caretaker, is too busy to go on the immunization day. You know, usually when you start the immunization from birth, you are given a card. And this card is very important because they've created very wisely quite a number of things to do with the child. So not only on vaccination days, not only do you get the vaccination, you get a health talk about how to take care of your child. You get to weigh your child and see how well your child is growing and developing according to the standard. And so it can easily pick out any deviations, which means if your child is maybe growing too fast, if your child is becoming obese, it will show on the card. If your child is growing too slowly, which means maybe your child is not very well nutritioned, it will show on the
the
card.
card,
So
wow.
the card is one of the ways that helps to make contact. But some parents are not able to make up the appointments, and so they miss the vaccination.
Okay.
But speaking of missing vaccination, it's important to note that there are things we call match up. You can catch up. Even if you missed, you can always come back, and based on your schedule and wherever you stop, your child can still be given the required vaccination
Wow.
to
That's
improve
important.
the coverage, yes, for your child. Another reason is that some people don't have good access.
Okay.
Though the government has tried to let there be public health care centers available in at least all local governments, but due to the nature of the country and some people not having good road networks, some people are not actually able to get to those centers to have the vaccination as required.
Wow. Okay. So these are some of the common reasons why.
Yes.
Okay. I think sometimes I think I've heard of a myth where they say if people are trying to prevent population growth by giving certain immunizations, so or giving certain vaccines, I think people believe that you know, they are trying to reduce the fertility in Africa with those vaccines. I don't know what you have to say about that.
That is not applicable.
Okay.
Usually, maybe if we notice a trend in the number of births, it's actually because of education, people valuing themselves, actually having better childhood survival. So they don't need to give birth to 9 children to have 3. They can give birth to 3 children and keep the 3. So they don't need to keep trying to give birth constantly to have what it is. And also, people are beginning to understand a lot more about the importance of taking care of the children you have very well, and that takes resources. And if you have too many children, you can affect those resources.
Okay.
And also, some of the things, the general package is being offered when you go for antenatal, when you go for even this postnatal care, when you go for immunization. They talk about family planning and the need to reduce the burden on the mother for having too many children. So all those factors contribute to make it seem as if people are having less children.
Okay.
But rather, Nigerian population is increasing by leaps and bounds every year,
Yes,
which shows that the vaccination has had little effect on the fertility of Nigerians.
I hope we're hearing that.
Yes.
So, based on our current population, we can't say that our vaccination has prevented our
Yes,
population to
because
grow.
this vaccination program has existed since 1978.
Wow.
And
Okay.
Nigerian population has doubled and tripled
Since that time.
then.
Yes.
So we can't say that it has effect on our fertility.
Okay.
Yes.
Thank you so much for
You're
that
welcome.
explanation. So what we are trying to say is we're trying to educate you about the importance of immunization. It's better to prevent this disease or reduce their severity if they come up at all than to wait for the disease to come and then you start treating them. So we'll be going on a break shortly, and when we come back, we'll just keep talking about vaccine preventable diseases. Thank you.
And welcome to Clear on Health.
TSTV, connecting your world. from the day you took your first step. We were happy with that great achievement. From then on, we kept taking many greater steps together. From sunrise to sunset, we kept moving together. Because they say, if you want to go far, never walk alone. We never stopped believing in the big dreams we share. From one moment to the other, we remain faithful all the way, bringing all your favorite moments to you, thereby making you a better version of yourself. We announced you to the world, and we brought the world closer to you, making all your journey of life a very meaningful and well-fulfilled one. We are proud to call you our friend. We are TSTV.
And welcome to Clear on Health.
TSTV, connecting your world.
Welcome back to our program Clear on Health on African Health Television on TSTV. So far, we've been talking about vaccine preventable diseases, and we went on to focus on children. With me in the studio is Dr. Oreka Ashi, and she has done a very good job educating us about certain illnesses. So far, we've talked about tetanus, we've talked about yellow fever, measles, chickenpox, and a host of others. And we also mentioned, the ways we can. We talked about the fact that these vaccines are available in our healthcare facility, and the work the government has done to bring it available for everybody. We also talked about the vaccines that are on the schedule, already paid for by the government, and those that are not on the schedule but can be gotten by payment of a fee at a particular facility. Then we also talked about other factors that can help children prevent infections that are not, from vaccines. We talked about overcrowding, these are the basic things now we are seeing in this time where we have the COVID-19 virus. Overcrowding, good hygiene, breastfeeding, good nutrition for the children. So Dr. Ashi, what are your last words? We've talked a lot about vaccines, but what are your last words to people at home about, vaccine preventable diseases?
Okay, if there's anything to take from this interaction we've had,
yes,
it's important to note that there are diseases that are preventable by vaccines, and the vaccines are easily available for everybody to get. The government has done such a wonderful job in making those vaccines free for parents to access for their children, and they shouldn't shy away from this vaccination period, because it is something that helps the child, helps to boost the child's chance of a good life. To prevent, there's nothing as worse as having something bad happen that could be preventable. So this just helps to prevent diseases that could cause permanent damage in children in the future. I mean, think about how rare it is to see a case of the shortened leg or the disabilities from polio. Think about how good it is to not see those in our children, on our streets, among our family. So this vaccine preventable diseases is in order to just be able to take care of it and take the vaccines where necessary. And is also a good amount of focus should also be put on the mother, so she knows that there are some vaccines that need to be taken during antenatal care for the child's development. And not just that, there is some care that needs to be given at birth. And important to note that even if you've missed this vaccination opportunity, there is opportunity for catch-up, and in which case you just go to your nearest healthcare facility and they will instruct you on how to make sure the child has their proper coverage. Another thing of note is, mothers, please keep your vaccination schedule, your vaccination card in a good place. So at any time when children go to school, because these days schools take this into consideration when they want to have a child in school. Has your child been vaccinated? So the child does not miss out on good opportunities because of lack of vaccination.
Wow, thank you so much for that reiteration. So I think one of the things I took from what you said was you can catch up.
You can catch
Now,
up.
the excuse of that you forgot is too high a price to pay by the child with a complication that could have, easily been prevented.
Yes.
Thank you so much for your time and for coming with us today on our program today. Thank you so much. So viewers, so far we've talked about vaccine preventable diseases. I'm sure you've learned a lot. We want you to know that there are vaccines available that can help to prevent certain illnesses in children. And thankfully, our government has made some of these important vaccines available free of charge. And the ones that are not free of charge can also be paid for. Thank you so much for joining us on our program today. Till next time when we meet on our program Clear on Health and talk about other health issues, please be safe, take care of yourself and your families and your loved ones. Thank you so much. Bye.
And welcome to Clear on Health.
TSTV, connecting your world.
And welcome to Clear on Health.
TSTV, connecting your world.
And welcome to Clear on Health.
TSTV, connecting your world.
And welcome to Clear on Health.
TSTV, connecting your world.
And welcome to Clear on Health.
TSTV, connecting your world.
And welcome to Clear on Health.
TSTV.